Hi, welcome everybody. See, we've got a lot of people logging in right now, so we're just going to give them a couple of seconds to come through before we get started. Okay, perfect. Everybody's right on time. I love that. So, hi everybody, welcome. We're excited to have you here today. Just want to let you know that we are recording this information session. So, for if any reason, if you need to log off early or if you missed something, you can actually go back and watch that. We're going to send out the link to anyone who registered for this information session sometime within the next week or so. So I figure we'll get started with some introductions. We've got several people on this webinar today. I'll get started with me. My name is Courtney Bibbo, and I am one of the admission counselors here at Massachusetts College of Pharmacy and Health Sciences. Namely, I work with applicants to our Manchester campus. And we do have admission staff from the other two campuses. Christine, do you mind saying hi?
Hi, everyone. I'm Christine Kademi. I work with our students applying to our Boston campus. Michaela.
Hello, everybody. I'm Michaela. I am an admissions counselor in the Worcester campus.
And then we have a couple of students here with us today. Sophia, do you mind starting?
Hi, everyone. My name is Sophia. I'm a first-year PA student on the Manchester campus.
And then Alex.
Hello, my name is Alex. I am a second-year PA student on the Boston campus.
Excellent. And then we also should have a Worcester student joining us for a little bit of Worcester perspective. She's just being a very good studious student. She's in class right now, and so she'll join us as soon as that gets out. Okay, so all of us are really pleased to be here today to talk to you about the university's program offerings through the School of Physician Assistant Studies. So during this session, you're going to learn about the university as a whole, the two PA programs that MCPHS offers, how to apply, and then we're going to go over kind of a Q&A session at the end to go over anything that we may have missed. So you'll see on your screen, wherever you can see your options, there should be a little widget for Q&A. That's where we're going to do the questions that you have rather than through the chat. It's just easier to track through there. So if you have questions throughout, feel free to post that right in the Q&A. And we'll be sure to answer those, whether we type them back to you or respond live. Okay? So great, let's get started. So first of all, we just want to congratulate you on choosing a career in healthcare. So healthcare is a great field to be getting into right now. Not only because it's one of the largest industries in the United States, but with an aging population, we're just expecting the need for healthcare providers to grow over the next several decades. So it's really a good place to be. I'm sure you guys know as future PAs that PA has also been ranked consistently at the top of best healthcare careers, according to US News and World Report. And our students are actually getting job offers either before they graduate or right after they graduate. So you know that you're going into a place where you can get a job immediately afterwards and you'll have high job satisfaction. So we do realize that going back to complete your master's degree is going to be an investment of both time and financial resources. But we really think that that combination of the great job outlook, the job satisfaction, paired with the quality of education that MCPHS can provide, that this is a really great investment of your resources. So if you're not familiar with MCPHS, I'll tell you a little bit about us. So we are a healthcare specific university, and I think that that's something really important to highlight. That's what we do. The programs that we offer here are all based in healthcare. So a lot of our faculty members are still working clinical days, and that means that they're coming back to the classroom, to the lab, teaching you real time what's going on in healthcare, what they're doing now. Not only that, but you're going to be surrounded by students in other healthcare programs. And so a lot of them are working towards an eventual licensure, where they're going to have to take that board and become a practitioner. And we host a lot of different school-sponsored activities where you're going to work with them and learn a lot from them. So we'll talk about that in a little bit. But we do think that that's really important, that we are a healthcare-specific university. We've also been around for a long time. We're actually in the middle of celebrating our bicentennial. So MCPHS has been around for 200 years now, training and teaching healthcare professionals. So we started out just as a small school of pharmacy down in Boston all those years ago, and we have certainly since grown a lot. We now have 3 physical campuses as well as an online presence and over 7,500 students at the university from all over the world. And I think that that 200-year legacy really leads us to have these amazing clinical affiliations with world-renowned healthcare hospitals and other facilities. So if you take a look at the bottom bullet on this slide, you'll see a very much not all-inclusive list of some of our clinical sites. These just might be some that you're kind of familiar with. We have clinical sites at Boston Children's, Brigham and Women's, Mass General, St. Vincent's, Lowell General, Lawrence General, Elliott Hospital, Southern New Hampshire Medical Center, and St. Joseph's Hospital. And like I mentioned, we have hundreds and hundreds, if not well over 1,000 clinical affiliations. So you're certainly going to find something that's great for you. I'm sure you're kind of wondering what it's like to be a student here. So I'm going to have the students jump in here in just a second. But, we do offer a lot of stuff here at MCPHS that can support you as you make your way through this busy and intensive graduate program. So Sophia, do you mind starting and kind of talking about IPE?
Yeah, of course. So something that really stood out to me when I was applying to PA schools was MCPHS's IPE curriculum, which stands for Interprofessional Education. And basically, at least once a semester, all the programs on your respective campus come together and either go through a case, or we had book club one semester. And you basically get to solve a problem or discuss an issue from all different aspects of different healthcare professionals. So as a PA, we know that we're really working in like a care team, like central hub. So we get to get ideas from occupational therapy and physical therapy and nursing and acupuncture and pharmacy. And so it really allows you to simulate what the work experience will be coming together as a healthcare team. And it's really cool because I'm not very good at pharmacology. So when we're learning all these, looking at all these different cases, we get to see pharmacology's input and OT's input. And so I think it's something that really distinguishes MCPHS from the other schools that I applied to, and is a main reason why I picked the university.
Great, thanks. Alex, do you mind jumping in and talking about kind of student support services that we have?
Yeah, so I'd like to first start off by talking about the faculty advisors at the school. On staff here at Boston, we have PAs from multiple different fields. So they all employ a very open door policy where you're able to really feel comfortable going to talk to them whenever you need to. We have specific faculty advisors that we can talk to about career opportunities and kind of how to navigate through our program. But if at any point you need to talk to a faculty member about a exam or any other questions you may have, they are absolutely willing to talk to you, and I feel very comfortable going to go talk to any of them. We also have peer tutors in each of our courses. So they're students from the year above who, if you're in like say pathophysiology or pharmacology and you need extra help, you can reach out to those tutors and they will kind of help guide you some study tactics of how to tackle a certain exam, as well as weekly like study sessions that they do. And before exams, they'll create whole practice exams for you. And the university also offers a case coaches, which are hired through the university to help out with study habits if you're having some trouble.
Yeah, and I think what's great is that all of this is kind of included as part of your tuition. So you have access to tutors who are current students for free. You have access to CASE. We also have an Office of Student Access and Accommodations. And so if you're looking for whether that's physical accommodations or other test taking type accommodations, that's something that we can provide to you here. We have career services that can help you as you start the job hunt. And we also have counselors on site. So if you're kind of dealing with, stress management or other stuff going on in your life, all of this stuff is available to all of our current students, included within their tuition. So something that's kind of important as you go into a busy graduate program. Now, I wonder if you two could also touch upon clubs and organizations maybe that you take part in while you're on campus.
Yeah, I can start off by talking about our PASS program. So the Physician Assistant Student Society is kind of our way of helping interact with our local community. Some examples of events that we've done is like a blood pressure clinic up in Mission Hill. There's like half marathons in Cambridge that we run. Last year, like our big one was the volunteering of the Boston Marathon. So that was an amazing experience. I'm very much looking forward to doing this year again. And we also do a lot of fundraising for certain charities that benefit students, such as the American Cancer Society, where 3 of our classmates just ran the Chicago Marathon. So we all helped raise money, which was also giving back to past credits as well.
Here on the Manchester and Worcester campus as well, we have SAPA, which is the Student American Associate of Physician Assistants. And we essentially do the same thing as Boston's PASS program, where we each semester have to have at least one kind of fundraiser, and we do a lot of fun things to kind of bring the cohort together. So recently we just had a Spirit Week for PA Week, where we got to dress up from where we went to undergrad and fun scrub colors for lab. And so it's a good collaborative group to kind of get into a leadership position in PA school, but you're also getting to interact and foster a kind of beginning in the future career that you'll be in. So we basically do the same thing as the Boston campus, raise money, do a whole bunch of fun things. It's a good place to get involved.
Yeah, and if you are interested in joining any other clubs and organizations, we have PA specific ones. I believe Boston has 2. And then we also have other clubs and organizations that kind of anyone can join. So if you're interested in making change on campus, we have Student Government Association. If you're super into event planning, we have Campus Activities Board, Outing Club, several different religious-based groups. We have parent associations if you have kids while you're in school, and tons more. So, even though you're going to be busy in your grad program, there's certainly a lot of ways that you can get involved. And typically it's usually only like once or twice a month commitment. And I know at least for the accelerated program, they do a lot of those meetings on like a lunch break, and maybe they'll provide lunch or pizza or something like that. So, it's not like it's tacking on to your schedule. It's something that you're already on campus anyway. So let's talk about the campuses where our PA programs are offered. So we offer PA programs at all 3 physical campuses. So we'll talk about each one of those, starting with Manchester. So even though we're Massachusetts College of Pharmacy and Health Sciences, we do have a location in southern New Hampshire, about an hour north of Boston. So that's where our Manchester, New Hampshire campus is located. And this campus is in downtown Manchester, which is known for its New England charm with small businesses, shops, local restaurants, and historic architecture. Within a short walk or drive from campus, you're going to have access to lots of different things, including parks, museums, local sports teams and arenas, local and historic theaters, concert venue, and more. We're also really well placed for kind of getting anywhere you want to go, any kind of environment you want to be in, I would say. So we're a small city in Manchester, but if you're looking to get that kind of bigger city experience, like I mentioned, we're an hour north of Boston, so you could do like a day or a weekend trip down there. We're about an hour away from the seacoast if you wanted to head out to the beaches. And then if you travel northward, you get into the lakes region and kind of Franconia Notch in the mountains. So there's a lot of really beautiful stuff in nature to see, especially near the Manchester campus. We have lots of state parks and a lot of places that have like trails that you can walk through or hike through or cycle through. If you're into, camping, hiking, skiing, snowboarding, going up to the White Mountains on the weekend is an awesome, awesome trip. It's actually really nice this time of year because we're kind of right smack dab in the middle of fall. So the height of leaf peeping season, I definitely recommend getting up to the White Mountains if you can make it. So Manchester and the surrounding area is home to 15 different colleges and universities. This campus, like I mentioned, is our smallest campus. So we have 4 different healthcare programs. Aside from PA, we have occupational therapy, pharmacy, and nursing. All programs offered in Manchester are year-round, meaning that we do have a summer semester. And at around 400 students, this smaller campus makes for a more intimate and close-knit atmosphere. So you're definitely going to get to know all of your classmates and all of your faculty really well, but we definitely have a culture where kind of everybody knows everybody on campus. And so you'll really get to know the students from the other programs. And depending on how active you are on campus, you're going to make some lifelong friends, both inside and outside of the PA program. So MCPHS Worcester. Worcester, if you're unfamiliar where it is, we're about a 45 to 50-minute drive from Boston, right smack in the middle of Massachusetts. So this is the second largest city in New England after Boston. And Worcester's really an area where you're going to find healthcare at your fingertips. If you stand outside of this building right here and look to your right, that's on this slide, you see St. Vincent Hospital, which is one of the biggest hospitals in the area. And we have students doing clinical rotations right there. And within a 10-mile radius of campus, we have tons and tons of clinical rotations. So this is also an up and coming city with a really rich history. NPR actually named Worcester the new IT town in 2018 as it's become a booming hub of innovation. So we were once an old mill town, and now we have lots of great restaurants, sports centers, arenas, parks. If any of you are from the area, Woo Sox, Worcester Railers, you can get discounted tickets from student affairs while you're here. Go see a game. It's really fun. And it is really centrally located as well. So it allows easy access to cities, the mountains, and the coast, and definitely has some really great public transportation to help you get there. So the university has really invested a lot in Worcester over the past decade to include new buildings, updated classroom and lab spaces. We actually have on-campus housing, and I would say if that is something that's important to you as a graduate student, on-campus housing, then this would really be the best campus for you. And we also are unique in that we have several clinics on site where some of the students from our other programs are actually able to service members of our community. So we have clinics for optometry, dental hygiene, physical therapy, and acupuncture. And then last, but certainly not least, is our Boston campus. I don't typically have to tell our attendees where Boston is. Most people are familiar with that. So, Boston is located right in the heart of what's called the Longwood Medical Area. So you're a quick walk away from really prestigious healthcare facilities. You're thinking things like Beth Israel Deaconess Medical Center, Brigham and Women's, Boston Children's Hospital. It's right down that main drag, and that's where we are as well. So Boston is the epicenter for healthcare in New England, where each day more than 46,000 employees and over 21,000 students come to work and learn. The Longwood Medical Area averages 6,500 job openings annually, and 2.6 million patients are seen each year. The Boston campus is primarily an undergraduate campus, but there are still several graduate programs that attend there, including a physician assistant program.
All right, so let's go into talking about those programs a little bit. So we'll go ahead and start with the Manchester and Worcester campuses. So for the PA programs, those have a spring start. And one kind of unique thing about this start date is that compared to other PA programs, This means that our students get to graduate in December, which is great because that's actually a time where fewer people are applying to positions and applying to jobs in their field. So it can be a great benefit to having that spring start. This program does go year round and including summers, which is why it's considered an accelerated master's. And it goes for 2 years. The first year is a 12-month didactic year. After that, you move into 12 months of your clinical rotations. These are split up into 9 5-week rotations that can be all over the Northeast. And those are offered both at our Worcester and Manchester campuses. Our Worcester cohort has 70 openings for seats for our students, and our Manchester campus has 55. We also like to note here there are no noticeable differences between the two campuses. They have the exact same schedule, the same curriculum, and there's no major difference in the program at all, just the location. And we also like to note about that as well that the acceptance rate is the same at both. So even though there might be 70 seats in Worcester and 55 in Manchester, they both have the same acceptance rate for both programs. For our Boston program, we have a fall start. And this is a 32-month program total, 32-month program. That includes 4 semesters of your didactic and then 3 of clinical rotations. And this program follows a typical fall-spring schedule for your 4 didactic semesters. So you do have the summers off during those first 2 years there. And then after that, you will have year-round with summers included that begin on your 2nd year in the program when you're on your clinical rotations. And this is also includes the 9 5-week rotations all across the Northeast. For Boston, our class size is 100 with some seats taken by internal Boston Pathway students. So Boston does have a pathway program where some students get put into that. And we also like to note here that for the prerequisites, it requires 33 semester hours as one of the requirements as well. In your clinical years, there are 9 different types of rotations that you'll complete during the program. You can see them listed out here. You'll be assigned different rotation sites ahead of your clinical year so that you have time to plan. We want to make sure that you have time to do whatever you need to do before doing that. So you will have time to do that. And these sites are all over the Northeast, but we do have some high concentrated areas in New York and Mass as well. So those are listed there for you, and we'll go over your rotation sites as well. So here you can see the different locations of those sites. We do have some sites outside of New England, across the country and internationally. But you can, as a student, you can put in preference to where you want to go. So you can kind of beforehand put in preference that you want to go in a certain state, and that will be considered. And you can also go coordinate sites across the country as well. So just because they're listed here doesn't mean that you can't, say request going to California. You could absolutely do that if that's where you're from and you'd love to have a rotation close to home. You could absolutely put in a request for that as well. Let's see. So can our students talk a little bit about how that rotation selection process works?
I can start. So what you do is, for the Manchester and the Worcester campus, we gave preferences in August, so 8 months into our didactic year. And for each rotation that they had on the slide previous, you get to rank spots 1 through 20 of where you want to go. So you rank the location, the hospital, and the preceptor. Some places only have 1. And then that's open for about 2 weeks. And then at the end of September, we got all the rotations. So for surgery, you're here with this preceptor. For internal medicine, you're here with this preceptor. So you get everything starting. Since we start rotations in January, we got it about 3 months in advance, and you get the whole year. So it's a pretty easy process. It does go through something called the spin. So if Shelby and I both really wanted like one hospital really badly and they only had 1 spot, it basically goes through like a lottery system to assign you. But if no one wanted to go to some random hospital in Maine and I ranked that as my top, I would probably get it. So it really depends on the other students in the cohort, who else ranks what and where you want to go. But at least in my experience, I got at least my top 3 options for most of them. So it works out pretty fairly.
Yeah, and I would kind of agree with Sophia. I'm from Minnesota originally, so I wanted rotations obviously back home because that's kind of where I want to lay down my roots. So I wanted my connections back home. The process was super easy. You kind of just find, but it's kind of on your own, if that makes sense. They're not going to hold your hand completely through it. So if you want a place or you have connections, you know, you reach out to them and you contact them, and then the school makes it really easy for you to get those assignments and make sure that you're placed in some place that you're actually going to want to be in the future. And like Sophia said, I personally, again, like not from the New England area, so I chose places all over the country. I have a couple in Florida, I have one in Arizona, one in California, obviously 2 back home. So I got those as choices. So it was easier for me in the sense that I luckily kind of got all of my top choices based on the fact that I wasn't choosing a school in New England. And I think that's not common for a lot of other students. A lot of them like to stay in the New England area, and a lot of them, like Sophia said, did get along their like top 3 choices. And I think that's really beneficial. But I think it also proves with my point of MCPHS has a lot of connections throughout the whole country. So you can find so many different rotations and go so many different places and be able to start building your career wherever you kind of want. So I think that kind of proves to a lot of diversity where other schools I was looking at didn't really have that option. So I think that was really beneficial in choosing my school, like choosing MCPHS and then now being able to build my career.
So Shelby and Sophia hit on basically all the points that I know about. So we don't actually start submitting our requests for like placements and whatnot until January, I believe. We're in like the beginning stages of figuring all that out. So I have nothing else to add. They hit it on the head.
Great. Well, thank you all for sharing. And by the way, welcome Shelby. Shelby's our Worcester student who has joined us. So thank you for that. All right. Let's go into talking a little bit about direct patient care. We do get a lot of questions about what can count towards direct patient care. We realize that it's part of the application process and it can be very challenging since many programs have different expectations for what direct patient care actually is. So here are a few tips and important reminders when looking at that. So job descriptions and day-to-day responsibilities are more important than the job title itself. So definitely look at what you're doing in the position, not necessarily the name of the title. That's what you're going to want to look at there. All patient care hours must be completed prior to applying to the PA program. So your direct patient care hours that you put on your application, once submitted, those are the hours that we're going to take. So just make sure you understand that when applying. And patient care experience may not include caring for a relative or family member. So if you were taking care of a relative or family member, that's not considered direct patient care. It would be somebody else. All right. So going through this slide, we're going to talk a little bit about different examples and a role in which you're directly responsible for patient care. So administering medications, performing procedures, evaluating patients, bedside medical care, drawing blood, obtaining EKGs, directing a course of treatment, and taking vitals. So this is kind of what we talk about looking at that job description, seeing what it involves. You know, these are all types of things that would be considered direct patient care. So maybe the title might not directly say this, but these are all things that we would consider to be so. There is also one exception as well to that, medical scribes. That is an exception. We do take that as direct patient care. So just something to keep in mind as well. All right, so some examples of roles. The most common ways of getting patient care include nursing assistants or roles that require a CNA or LNA license, medical assistants, EMTs, things like that. And we also like to mention, again, you'll see on this list, medical scribe. So that does fall into this category as well. Candidates are definitely encouraged to seek out patient care in a setting where PAs work. So for example, you could get a position that's considered direct patient care in a dentist or optometrist office, but you may not have a PA working with you directly. So it is just something to consider. It is great if you are able to get one of those roles where you can work directly with a PA as well. If our students could also quickly go over how you got your direct patient care ahead of applying, that would be great.
I can go first. I had about 2,000 hours of being a certified nursing assistant and about another, probably closer to 1,000 hours being a nursing unit secretary.
I did probably about 1,000 hours EMT, probably 2,000 CNA, and then probably another like 600 of phlebotomy. So I kind of had like a good mix and like a good foundational base, and that's not common. Most people usually come in with one different thing, but I was just trying to be like knick-knacky and be like, all right, let's be a little versatile and just kind of see what else I liked. So that was my experience.
I believe I applied as soon as I hit the 500-hour mark. So I think that just goes to show that MCPHS really looks at you holistically, because I did not have 6,000 hours, but I did do research and got a master's degree. So if you're, for most schools, if they look at you holistically, as long as you pass the minimum, they take a look at your whole application, as me, because I literally had 1 hour over the limit.
Awesome. Thank you all so much for sharing. And I think exactly what Sophia just said, you know, at the end, MCP really does look holistically at our applicants. So that really drives home that point of, yes, you meet the minimums and all of that. It really is something that we're going to look kind of all encompassing at our applications as well. To speak a bit more, you know, diving more into the details of what the admissions requirements are, there are slight differences between the programs. I do want to take note, we say this kind of often, and I'll say it again later in the presentation, but when you apply, you can only apply to one campus. So we are MCPHS, even though we're different programs, we don't like to pit applicants against each other. So, you know, if you're kind of hesitant on which program you want, which campus you want, you can always reach out to Michaela, Courtney, or I, and we can help walk you through the slight differences that there are for the programs and what might fit you better. I do also want to encourage those of you, if you're wondering, you can use the Q&A section to ask us any questions. We can answer them throughout the presentation, but we'll also have a Q&A section right when we finish, which will be shortly, that you can ask our students questions as well. So as you can see with the slight differences here, on the left-hand side of your screen is Boston. We have a minimum GPA of a 3.0 overall science and prerequisite. We have a minimum of 250 patient care hours required when you submit that application, as Michaela had said. And then there's also PA shadowing that's recommended. It's not required. I always tell applicants, it doesn't hurt your application if you don't have it. It does help your application if you do have it. And it really helps you understand more about the PA profession, especially if you get offered interviews. So it's not required, but it is recommended. If you do submit any type of shadowing hours, shadowing a PA is what's going to count. And that's the only thing that will. When it comes to our Manchester or our Worcester program, for the accelerated program, we require a 3.0 overall, a 3.2 science, and a 3.2 prereq, which is recommended. I will say, along with the 250 to 500 plus direct patient care hours that are recommended, I don't think that they have interviewed anyone with missing either of those. So even though direct patient care is recommended, it definitely is highly, highly encouraged to have at least 250 direct patient care hours. There are also slight differences with our prerequisites. So pay attention to the few that are listed here. So for Boston, Biology 1 and Biology 2 are required. Anatomy and Physiology 1 and 2 without their labs. For Manchester and Worcester, Biology is not required to apply. Anatomy and Physiology 1 and 2 have to have labs. The other strong differences is that for Boston, there is 3 semesters of chemistry required. 1 has to be an upper level. For Manchester and Worcester, we require Gen Chem 1 semester with a lab organic chemistry one semester with a lab, and then biochemistry. So there's specific chemistry requirements that we have for Manchester and Worcester. So it's just important to know. For all of these, it also is good to, when you're applying, noting, even if you have the lab, it's not going to be counted over in Boston. So just little things like that we're happy to walk you through. So as I mentioned before, what are the application details? Applying to one campus only. For CASPA, if any of you have experience with CASPA, you actually may be able to submit to more than one MCPHS campus, but we will, at the time of receiving your application, send you an email and ask you to choose which campus you would like to be considered for. So save your money and just designate to only one MCPHS campus. I do want to note that CASPA opened up at the end of April. It does every year. For Boston, the deadline was September 1st. Of this year. So Boston, it's usually open from April to September. And for Manchester and Worcester, it is still open for the spring of 2025 start. And that deadline is January 15th of next year. So just in a few months, which blows my mind because I forget that next week is November. But so that application is open still for spring of 2025. For the CASPA application, on top of that, we need all official transcripts. Those get sent directly to CASPA. 3 letters of recommendation are required. CASPA does have a maximum of 5 letters of recommendation that you may submit. And they also will allow you to submit with 2 letters of recommendation, but we will reach out for a third. So please at least have 3 people lined up. We don't have any specifics for who the letters of recommendation are from, but we wouldn't want it to be from like a coworker or a friend. You would want it to be from maybe a PA you've shadowed who knows you more than just shadowing for an hour, someone you've worked directly alongside in the medical field, maybe a professor. So at least a minimum of 3. If you are from a different country, we do accept students who have degrees outside of the US. If that is your case, you will need to submit a transcript evaluation. That typically what we'll see is WES, World Education Services, ECE, there's a few others as well that we'll accept, but you'll get your course-by-course evaluation translated and then sent directly to CASPA as well. If English is not your first language, you will need a proficiency exam as well. For a little bit more about admissions details, we do need a C or higher in all prerequisite classes, not a C-. Usually that's a question we get pretty commonly. It's a C or higher. You can apply and be considered for an interview with no more than 2 outstanding, so either missing or in progress prerequisite classes. And there is a 10-year expiration on all math and science prerequisites. So the way that we think about that is if you're applying for fall of 2024, anything prior to fall of 2014 would be past that 10 years. So know that for your math and sciences. The one exception is psychology. Psychology is a soft science, so it actually does not fall under that 10-year limit. We will, as we mentioned before, we're going to look holistically at your application. We will prioritize higher GPAs, cumulatives, your overall, your science, your prereq. That we do have some frequently asked questions in the next few slides. So I'll talk about what our average GPAs have been for our incoming classes. We'll also look at your prerequisite progress, making sure that you don't have any more than 2 that are missing. Your experiences, your interest, your motivation, all of that comes into the holistic view. And then when you submit your application. So knowing that we are rolling admissions, so we review applications as we receive them, and we do hold interviews throughout the cycle as well. So knowing that the earlier you submit, you may be chosen for an interview sooner, may be able to fill a spot sooner. So it's really all about timing of application as well. Want to talk a quick about your interview day and then just hear some tips from our students about that. But for Boston, we historically hold our interviews in the summer through the fall. For Manchester and Worcester, they typically will start their interview process in October and will go through February and March. We will send out interview invitations by email. And if you are chosen for an interview, you will receive a link to be able to schedule that interview as well. In terms of how interviews are being held, we're doing them in a mixed format this cycle. So for next cycle, we'll let you know once it is determined. So what to expect from the interview day. So for our campuses, they all have an introductory video or a presentation that happens, interview with faculty and alumni, a written exercise for the Boston campus, and we have a student panel for Boston and Worcester and Manchester, but it's really well known for our Worcester and Manchester to have that student panel there. And then you'll also have a next steps with the admissions office when you'll expect to hear back with the decision and what to kind of expect for a timeline for us as well. I do want to pass it off to our students. What kind of tips do you have for interview day prep, something that maybe helped you out during that process? Whoever wants to go first, I don't want to choose you and make you go.
I'll go first. The main tip I have, I did help do some interview processes over the summer. The main tip I had for people was just to really just be yourself. You know, they already, from a transcript standpoint, from your application standpoint, they already think you're good enough to be in the program. So you really just have to go in there, show them why you, and know why that you want to be a PA, why this is the correct career choice for you. And yeah.
I would definitely agree. Find what makes you unique. I mean, we all know that you want to come in here and you want to help people. Obviously, we wouldn't be in medicine otherwise. So we get that. So just say something that is definitely geared towards like whatever passion you have. And if you don't have a passion, that's okay. Like some people don't in my class, but you still probably have like a personal experience or something else that kind of drove you home to want to be a PA. So just tie that in. And like Alexander said, like be confident. They already are interested in you. So know that that's a lot easier said than done, obviously. But yeah, and then I also did one mock interview right before with my college career services, just so I could kind of get some nerves out of the way and just be like, okay, can I think off the top of my head? And they also just like helped calm my anxiety a lot. So if that's available to you, I would recommend that. Otherwise, just ask like your dad or your mom or some family member or friend and write down like be like, okay, these are possible questions they could ask me, and then kind of just maybe do like a conversation at a certain point during whenever, and just see if you can think off the top of your head and it's a good enough answer for you. And it kind of just helps you formulate a more cohesive thought when you're trying to answer. And also, a lot of people don't like to do this, but if you just take a second and they ask you a question, you're like, okay, I need a minute to think about that and gather my thoughts, that's totally acceptable. I think that means that you're really thinking more deeply about a question rather than just shooting off the quickest thing that comes to your mind, and then you kind of missing a bigger point of what you really wanted to say. So I think don't shy away from taking a pause and gathering your thoughts.
I agree with what both of them said. I think what I really focused on was practicing. I practiced with my dad with a whole bunch of practice questions. And you already know that some of the questions they're going to ask you. I looked it up on like online and on YouTube. And now with TikTok, there's a lot of people talking about PA school interview experiences. They're going to ask you why the school, why you want to be a PA. But something that someone told me that really made me feel better is that they're always going to ask one question that you literally could have never thought of. And so that's when it's really important to take what Shelby said, take a minute and go with a more direct answer. Than I'm really good at talking around in circles. So I just keep going back and forth and back and forth, but it's good to take a minute, think about your answer and deliver it. There's always going to be one question that you don't prepare for, and that's okay.
All really great advice. Thank you so much. I was talking to some younger students earlier today and saying, the interview is not just a formality. It is something that's really important. So making sure you practice. And what's really nice too is that you'll hear from a lot of applicants that MCPHS, all three campuses, we have pretty laid back interviews where they really want to get to know you. And they want to know, as Alex was saying, why you want PA, why you think that you fit, why would you fit at MCPHS? So really important and something to know. You're showing yourself outside of the numbers on the paper and outside of those little things, and really just being able to say, this is me and this is why I want PA and why I'd be great for it. So all really important things. And thank you, students, for kind of sharing your advice there. I want to go over a little bit of some frequently asked questions that we have. If it answers one of your questions that you're thinking of right now, wonderful. If you want some more clarification, please feel free to write it in the Q&A. We'll be answering those live. So if you have questions for our students, just type those in. But what we hear most commonly, and we could say, Michaela, Courtney, and I can say all day we're answering the phone and emails about these questions. So absolutely, we're rolling admissions. As I said before, we review applications as we receive them, so get those apps in when you're ready to apply. For our average incoming classes, this has been steady over the last, I would say, at least 3 years. Boston, we have around a 3.6 to a 3.7 for overall science and prereq, and we have just the same for Worcester and Manchester. So 3.62 overall science, prereq, 3.59, 3.7 respectively. So as I mentioned before, if you remember back from the slide a couple ago for our admissions requirements to apply for Worcester and Manchester, we recommend that 3.2. As you can see, our students are well over that. Now, does that mean we interview with lower than that or higher than that? Absolutely. But we do this is where our averages are falling. There is no supplemental application. It is just CASPA that we're looking for. There are supplemental questions within CASPA, so there will be questions specific to the campus that you choose, but it is just the CASPA application. We do not require any standardized testing for any one of our campuses. We won't look at the GRE or the MCAT or the PA CAT if you submit them. Sometimes within your CASPA application, you will have that information posted there because maybe another school that you're applying to does require it. But since we don't require it, it won't be factored into our review of your application. Prerequisites can be completed online or at a community college. So we are looking for any regionally accredited institution. So if the lab is online, that's okay. If the lecture and lab are online or at a community college, because it's easier for you, if it's into your schedule, that's fine. If you have any questions ever about prerequisites, you can email us. You can ask now. There's stuff that we're able to answer specifically to see and make sure that prereq fits what we're looking for. As I mentioned before, but I definitely will mention it again, any type of shadowing, it has to be with a PA in order for it to count. Shadowing is not required, but it is recommended. If you're shadowing an MD or nurse, we won't count those for shadowing hours, though it is still good for you to understand, this is what I want to do. I want to go into PA. I don't want to go into to be an NP. So something like that might help you. We just won't count those hours. For simplicity, since we receive a large number of applications to all 3 campuses, your application is going to be reviewed upon submission. If you have updates, if you have, you finished a prereq, you gained more patient care hours, that's wonderful. We understand that a lot of applicants are still working, still gaining those hours. Obviously, if you have in-progress class, you're going to complete that class, but we won't update your application once we do receive it. We're going to view it how it is at submission, which is why when you submit it, you want to have the best application you can, because we won't be able to update it. Even if you update CASPA, we don't go and download a new one. So just keep that in mind. For credit, for any prerequisite classes, if you took an AP exam back in high school and maybe you got that credit when you went to college, we absolutely can accept that for prerequisites. You do have to have a 4 or a 5 in the class. It has to match up, obviously, with what we're looking for, stats, psych, biology for the Boston campus. So you would want to take that into consideration as well. But if you do have that credit, I would always recommend sending the scores directly from College Board to MCPHS because you can't send them to CASPA. You would want to send them to us directly so we know that class is completed. For AP classes, they fall under the same 10-year expiration as any other math and science prerequisite as well. And a common question we get is if your GPA falls below the minimum requirement that we have, can you still be considered? Unfortunately not. Due to the competitive nature of our program, we just do not had the ability, and with the accreditation, we can't consider any students who don't meet all of our minimum requirements. So those absolute 3.0 minimums for our GPAs and 3.2 minimums for our GPAs. So please keep that in mind as well. Pass it off back to Courtney. And please, use that Q&A, use the chat box. We're happy to answer any questions.
Yeah, excellent. So, yeah, especially for our student panelists who are here, you've got them live for the next several minutes. So please do submit some information now. If you do pay attention to this page, I don't know if you want to take a screenshot or just like kind of take a picture just so that you have our contact information by campus. So if you know where you're applying, you would contact your admission counselor directly. I also wanted to take a quick minute to talk about some receptions that we have coming up for the accelerated Master of Physician Assistant Studies specifically. So we are offering on-campus visit opportunities in the next couple of weeks, actually. So Thursday evenings in early November, we're going to invite students to come join us. It's on November 2nd in Manchester and November 9th in Worcester. What I'll do is I will paste those registration links in the chat before we get off today. But really, I mean, I think this is the best way if you're looking at the accelerated program to get to know us. You're going to come to campus, so you're going to see the PA labs, class, facilities, but you're also going to get to connect with our faculty. You're going to connect with our current students. And we also have alumni coming to both campuses. So people who have actually graduated from this program and who are kind of out in the real world working. So these are really fun events to come to. We're hoping that, being after work, this will be a great time for our local candidates to be able to join us. And I just popped that into the chat. We also have tours throughout the year. If you can't make it specifically on these November dates, we have in-person tours and we also have virtual tours. So I'll put that in the chat. But before we get to that, I'm just going to ask a question that we like to ask all of our student panelists while they're here. So obviously, a lot of people apply to multiple PA programs when they're applying to PA schools. So could you share with us why you chose MCPHS?
I can go first. So I actually had worked with a MCPHS PA. I shadowed an MCPHS PA, and they had absolutely nothing but good things to say about the school. They were very confident in their work. And being a pharmacology school, they felt very confident in pharmacy coming out. So that really interested me in coming to the program. As well as I mentioned earlier, there's faculty from multiple different specialties. There's cardiology, cardiothoracic surgery, orthopedic surgery, hematology, oncology, GI. So on the Boston faculty, there's a wide range of medical specialties being represented so that you're able to really have further conversations with these professors and then learn from them as well, how they're experts in their field. And the last thing is I am from Boston, so it was quite an easy choice for me.
So obviously I'm not from Boston. I am, again, I kind of went off the rails on this one and I applied the day before the deadline and only applied here. I had obviously done research prior, but in the cycle that I wanted to apply in with CASPA, I was very on the edge because I was like, maybe I wanted a gap year or not. And some of my friends were like, well, why don't you just apply, just see what happens, at least get that experience of having an interview and going through the whole process. And thankfully MCPHS picked me up. But what drew me in from straying away from the Midwest was the amount of opportunities that I would say that the East Coast offers compared to, I would say, a lot of other states. I mean, it is a mecca of healthcare. You have Mass General, you have Dana-Farber, you have so many other places that you can have connections to. And I really loved that aspect. And also, I liked the longevity of MCPHS. It's very established. It's been here for I think, what are we celebrating the 200 years or something like that. So you know that what you're getting with this program is long-standing and it's not something new. So they've kind of worked out a lot of different kinks. And like Alex said too, our faculty is a huge array of different professors from a lot of different fields, which gives you a huge variety of different disciplines and also mindsets on how you can do things and how you can manipulate the body to kind of work with what you have and the knowledge that you bring. So I think that's been super beneficial, especially in patient assessment or like our actual clinical work, because we have like a dermatology professor, and right now we were just working with shave biopsies and doing a few dermatological procedures. And obviously, like, I'm going to get great experience because I had that with her. So I think that was that's been a big benefit, but I knew coming into here that they had a wide array of faculty. So I like that.
Yeah, I agree with what they both said. I was keen to MCPHS because the PA that I shouted also went to MCPHS Manchester. And when it came down to like the thread, I was going between two schools, and my dad was like, have you ever heard of like the other school I applied to? I'm like, no. He's like, but have you heard of MCPHS? And I was like, yeah, I have. So aside from an awesome interview experience that I had, I think MCPHS was the no-brainer. And I actually live in Massachusetts, but I chose to go to the Manchester campus because I like New Hampshire, and I had been to New Hampshire a lot when I was younger. And I picked Manchester versus Boston because I wanted the 24-month program. I wanted the accelerated program. In my opinion, obviously everyone has their own opinions. I knew PA school was going to be difficult no matter where I went, so I wanted to go in and out in 24 months and just get it over with. But I'm very happy with my decision, and if I had to do it again, I would pick MCPHS Manchester like 1,000 times over. The professors are awesome. I literally love all of them. The class, like the students that we have like a really good environment where we share resources and stuff. I think that this was the best option that I could have picked.
Plus, you had an awesome admission counselor, right, Sophia?
Can I say?
All right, so we've got a couple of questions left. We're going to try to get through these quickly before we have to end the presentation. We don't want to keep anyone on here too long. But for our students, again, how do you find participating in clubs or even outside recreational activities and then juggling that really busy didactic coursework? Is that manageable for you?
I can go first again. So since I'm in my second year, I find it much more manageable to quote unquote live a life. Because we are a longer program, it allows us like more spaced out exam times and less crowded days of classes. Like this semester, I have one lab on a Tuesday and no classes on Thursday, so I'm able to participate in volunteering opportunities, go work out, go to the grocery store, go cook a nice meal. So it's easier for me to say that I can be able to juggle all of the work.
So Sophia and I are obviously in the Worcester, Manchester, and we're 24 months. So a little bit different from Alex in the regard that our exams are very much so happening. We have like probably 2 a week, but that sounds kind of ominous and like, oh, scary, but you manage it. You figure out your time manageable skills. And usually on the weekend, what I do and what I've heard a lot of other people do is split your weekend up into like 5 different things. So Friday night, Saturday morning, Saturday night, Sunday morning, Sunday night. And I take like 2 or 3 of those just for myself. So that I find time. I've gone to Salem, Massachusetts. I've even flown home a few different times throughout the semesters, even during busy weeks. And I found that it still works if you time manage correctly. And also with Worcester, I don't really know about Manchester or Boston. For clubs, I would say that we don't have a ridiculous amount in PA school. It's not, we choose, I guess, more to spend time for ourselves rather than being in a club. But if you're definitely interested, you can start them up, you can join them. There's flyers all over campus, so you do have a lot of access. It's just more about picking and choosing your times. My friend and I, though, we also go to the gym, and her and I, we work out all the time, so we are able to fit in like good hot girl walks, nice little workout times, and it's time to like spend with family and friends. So it's manageable. You just have to make sure you manage your time well.
I won't keep beating a dead horse. Exactly what they said is exactly right. I think as you go through the program, you get to see what you can like get away with more. So first semester, I really had no time to myself because I spent every minute studying. But third semester and the last semester of didactic year, I know that I don't need to spend, I don't know, some ridiculous amount of hours studying for one exam, and I can take the time to go to the gym or go on a walk and hang out with friends. So you get equated to it regardless.
Awesome. And I think if we have time for just one more question, I would love to hear a little bit more about housing. We've gotten questions about housing in the chat. And I'm assuming this is particularly on campus housing. So perhaps a better question for Shelby from Worcester, if you could kind of touch upon that.
Yeah, so there's a lot of different options. I live in Salisbury, which is more apartment style. There's Foster, which is more roommate dorm style. And there's a few other options, but it's easy for me because I didn't have to buy furniture. Everything's fully furnished, and I get my own bedroom and bathroom, which is super huge being an adult and having and wanting your own space. Also, it's a fixed rate, so they take it out of like my financial aid, I think, at the beginning of every semester, so I don't have to worry about it month to month, which has been a huge stress reliever. So I don't have to worry about bills every single month. So I would say if you're debating it, I would choose it if you have that availability. And there's also a lot of other different options. They're all on the site, but I know with time I won't talk on the other ones.
All right. Yeah. So Worcester really is the great place to be if you want on-campus housing. So Shelby is in those residencies that we offer, and we do have that kind of mix of, studio style apartment all the way up through, we own townhouses. So it's very much like living kind of off campus in a lot of our residences, and looks a little bit different from what you might be thinking as far as like undergraduate housing, dorming, really. So I think that's about all the time that we have here. Hopefully we've been able to answer those questions for you. And again, if you have questions after this, it's certainly not the end of the line. So you've got our contact information here. Please get in touch. Use the chat to register for one of our events. We would absolutely love to see you in person and meet you. And I just want to thank our students for coming by today. I know you guys are in the middle of a super busy semester. So thank you so much for contributing today and helping out our applicants. And to our applicants, hopefully we'll see your application soon. All right. Take care, everyone. Best of luck.